Good afternoon. It is noon, and we're going to talk today about hormone replacement therapy, or as I like to call it, hormone balancing therapy. Now, there are all kinds of internet sites, there's all kinds of information. I don't know what you've been told. I learned about hormone replacement from a medical doctor who is an OBGYN, and he was talking to me about hormones, not just your sex hormones, but we did talk about sex hormones. And so I want to talk to you today, and I want to give you some information on synthetic hormones and on the natural bioidentical hormones. It's not a one size fits all, ladies and gentlemen. It's not a one size fits all. There's a lot of money to be made in synthetic hormones. You're going to be on them long term, and there is a cycling effect to them, such as when you get them, your symptoms go away, but then after a few weeks or a few months, your symptoms come back. So they up your dose. Then your symptoms go away, and after a few weeks, or months, they come back. And so it's a vicious cycle. That's not necessarily good for us. Now, a lot of people think that your sex hormones are just so that you can be vigorous and enjoy the pleasures of life, but that's not really the truth. That is part of the truth, but your hormones are also immune modulators. That means your immunity is going to be stronger if you have the right amount of hormones. Now, a lot of people don't know, but your liver helps make your hormones. How is that? Because your liver is where cholesterol is conjugated. Okay. Cholesterol is not a bad chemical. Cholesterol is something your body needs. Every cell membrane is connected to cholesterol. Your fats, your hormones, your brain, all of it is connected to cholesterol. And so if your liver's not functioning properly, then you're not going to have good hormone function. Now, a lot of times here in the clinic, we'll have people that come in and women who come in and they say that they have hot flashes. Well, we've noticed a correlation between a toxic liver, a stagnant liver, a congested liver, and low hormone production. All right. Nobody's going to tell you that, but we have seen time after time after time here in the clinic when we detoxify the liver, we get the liver flowing the way the liver needs to flow, then the cholesterol is able to be made, it's able to be conjugated into the hormones, and the hot flashes just disappear. So, I'm going to give you just a lot of good information about hormone therapy. And one of the things that you need to know is that most of the time your symptom, if you're a woman, and I'm primarily going to be speaking about female hormones. Men, you're just not that complicated. Don't mean any offense there. Women are just a little bit more complicated. A lot of times women will think their hormones are great until they get to an age postmenopausal where they start having vaginal dryness or vaginal atrophy. A lot of times women will think that if they don't have those symptoms, then they don't have a problem. I used to think that. I used to think I don't have a symptom. I'm postmenopausal, but I'm eating well and all that kind of stuff. So I don't have a problem. But when I went to hear this doctor, and he is Dr. Jack Monaco, you can look him up. He's a medical doctor, OBGYN. And he taught me that 95% of cardiovascular events in women happen over the age of 65 to postmenopausal women, and that if you would supplement with estrogen, bioidentical estrogen, then you would not be liable to have a cardiovascular event. So this is one of my maxims in life. I have two. One of them is don't work hard, work smart. All right. And so I don't have to learn everything myself through my own experience. I can listen to somebody who's really smart, who is a professional in the field, and I could say, okay, this is what this professional, and he believes in the holistic way of treating. And so it was just really easy for me to learn from him. So in 1966, now we're going back a minute. All right. Hormone replacement therapy was kind of the thing, and they targeted women, and they told women that if they did hormone replacement therapy, that they would find the fountain of youth, that they would not get joint issues, they would not get wrinkles, they would not have the vaginal atrophy, et cetera, but they marketed it to women, and they said you're going to lose your mental faculties and go into mental decline if you don't have this hormone replacement therapy. Now, we know that you do need your hormones for mental stability, but the synthetic hormones that were all the rage in 1966 are just not what the answer is. And so they started recommending hormone replacement in 1941, and they started recommending conjugated equine estrogens. So they would get a pregnant mare, they would get her urine. All right. I mean, why would anybody even think that that would be okay, right? And they would make this conjugated estrogen from pregnant mare urine, and then they would do this as a supplement or a prescription for women. Wyeth, Wyeth, was the pharmaceutical company that did this. Pfizer, we all know Pfizer because Pfizer's been in the news recently. Pfizer bought Wyeth in 2009. Okay. Now, the research, interestingly enough, the research that said that women needed hormone replacement therapy was based on a best-selling book called Feminine Forever, written by Robert A. Wilson, who was a Wyeth-funded gynecologist. All right. He called postmenopausal women flabby, shrunken, dull-minded, and desexed. Now, why anybody in their right mind would have listened to that, I have no idea, but they did. And so by 1975, the New England Journal of Medicine published disturbing research entitled The Association of Exogenous Estrogen and Endometrial Carcinoma, so cancer of the endometrium. Now, the endometrium is the lining of your uterus, ladies. You probably know that. You probably have heard, maybe even have experienced endometriosis. That is inflammation of the endometrium. So in 1975, this medical journal, showed the correlation between synthetic estrogen and this cancer. Now, they found that women who were taking hormone replacement therapy had 4.5 times the risk of endometrial cancer than those who are not on hormone replacement therapy. In 1979, the same journal said that there was a sharp upward trend in incidence of endometrial cancers that paralleled a substantial reduction in prescriptions for replacement hormones. Okay, so that was in 1975 and then 1979. So two research studies that showed that synthetic hormones spiked endometrial cancer, which we did not want to do that. So the drug companies, not wanting to lose a dependable franchise, right, which is prescriptions, added progestin to the estrogen, which it reduced the risk of endometrial cancer. Drugs such as Prempro were then debuted. It combined those two hormones. In 2001, more than 126 million prescriptions for hormone replacement therapy were written in the United States, according to the New York Times. So how were the drug makers able to convince us that we needed to have hormone replacement therapy? Well, it was, as I said, presented as a fountain of youth. Anti-aging therapist pushed it. Lauren Hutton, who was a beautiful actress, maybe she's still alive, I don't know, but she pushed it. And then in addition to the youthful skin and hair benefits, scientific papers claimed that HRT therapy would decrease the risk or delay the onset of Alzheimer's in postmenopausal women. So what they did not know at the time, what you didn't know, and I didn't know, that those quote unquote scientific papers were written by marketing people, not written by gynecologists. All right. In the 1970s, newer hormone replacement therapy became linked to cancer, and scientific papers such as "Is there an association between hormone replacement therapy and breast cancer" came on the line. Sex binding globulin and breast cancer risk. At least 26 scientific papers defending or promoting the therapy were commissioned by, guess who? Wyeth, the pharmaceutical company, not written by doctors. Okay, so this is something that we need to understand. I've got a previous program called How Medicine is Being Manipulated, How Politics Manipulates medical treatment. So you want to go back and look at that and see what you're getting on that. All right. So it soon became apparent that hormone replacement therapy needed defending. Okay. A study found that women on hormone replacement therapy had 26% higher risk of breast cancer. So not only are women using synthetic hormones, are they getting the endometrial cancer, but they're also getting breast cancer. They also had a higher risk of heart attacks, a 41% higher risk of stroke, and a double risk of blood clots. Now, this is one thing that the doctor that I went to that seminar, he told me that synthetic estrogen, which is what you're going to get in your prescriptions, did increase the likelihood of cardiovascular events. So no hormone balancing therapy increased cardiac vascular events. Synthetic hormone replacement therapy increased risk of cardiovascular events for women. So women, you don't want to do nothing. Yes, we want to shun the prescription, but we don't want to do nothing there. Okay. So there was newly released data published in the Journal of the American Medical Association that found also with the synthetic hormone, there was an increased risk of dementia. All right. These findings, coupled with previously reported data, support the conclusion that the risks of estrogen plus progestin outweighed the benefits. So the researchers wrote. Now, remember, the researchers were paid for by the pharmaceutical company. Other studies found that women on hormone replacement were more likely to lose their hearing, develop gallbladder issues, develop asthma, develop melanoma, experience urinary incontinence, right? So of course we've got all the ads for adult diapers, right? Nobody wants that. I was so glad. I was younger, but I read an article maybe when I was in my 40s, late 40s, and it said that you did not have to have urinary incontinence as a woman getting older. And I thought, well, hallelujah, because that was just not in my life plan. That was not in my story. I had not written that. And I'm just here to tell you, it's still not in my life plan. And I'm just very thankful for that. So you don't want melanoma. Melanoma is a skin cancer. And so this research showed that women who were on synthetic hormone replacement had these increased risks. So it not only made breast cancer more likely, but it also made detection of said cancer more difficult. A 1995 article in the Journal of Radiology states that, quote, an increase in mammographic density was demonstrated in most subjects undergoing continuous combined hormone replacement therapy. In 2008, researchers said that, quote, this adverse effect on breast cancer detection should be incorporated into the risk-benefit discussion between the woman and her doctor. All right. So even the radiologists who are doing the mammogram say, hey, we need to maybe rethink this because the synthetic hormone replacement is hurting our ability because the breast is really, really dense and we're not able to see the cancers. So as doctors and patients absorbed the extreme hyping of hormone replacement therapy benefits and hiding its risks, prescriptions dropped precipitously, and so did breast cancer. Between 2001 and 2004, U.S. cases of breast cancer in postmenopausal women dropped by 8.6%. Estrogen-fed breast cancers fell by 14.7%. So this is really, really important because you're getting your estrogens not only from your synthetic hormones, but you're also getting them from the plastics that package our food. You're also getting them from the meat and the poultry that you eat, the dairy products that you eat that have hormones in them because the farmers are using hormones to fatten up the chickens faster, to fatten up the beef faster. So we are getting meat, poultry, and dairy laden both with hormones and with antibiotics. None of that is good for us. Okay. It is just not good. We've got tons of podcasts on that. We've got tons of videos on that. So if you want more information, then there's lots of resources out there that we've given you. So what about the men? Okay. How many of you have seen on the television, on the radio, heard on the radio, all about low T? And I have to laugh because I've been around a long time and young men are coming to see me with quote unquote low T. And I'm thinking back to my younger years and it's like, you know what? Men never had low T. I mean, they just didn't. I remember being, in college, finding out that Charlie Chaplin was in his 70s and still fathering children. I mean, low T is something that's fairly new. Now, is it a real thing? I think, yes, it is a real thing, but I also think it is over attributed to men because lifestyle and diet are your real funders, for lack of a better word, of your hormones. If you're eating a poor diet, if you're a couch potato, you're not going to make estrogen. You're not going to make testosterone. You're a couch potato. If you're up and about and active and you eat well and you are absorbing all of your nutrition, then your body is going to do what your body needs to do. So the second meltdown, okay, of hormone replacement therapy was the lowest hormone dose possible for the shortest duration. This was your medical recommendation for menopausal symptoms. Long-term use was discouraged despite positive estrogenic effects on the bones. But the drug makers did not concede the anti-aging territory, especially because drugs taken long-term, think statins, think blood pressure, are their best products versus short-term products such as antibiotics, which really gives them no long-term money. So you always have to follow the money there. Women in the study, this is what they said, women in the study were too old and too menopausal, the drug maker said. The doctors and the researchers said, and these are doctors and researchers that funded the HRT drugs, okay, said that they should be used even earlier, up to the age of 35 years old. We want to catch you when you're young so that we have a lifelong patient here. So the concept of perimenopause was born, and it said that these symptoms could occur as early as a woman's mid-30s. All right. So just when you get used to PMS, they say that you have perimenopause. That was a cartoon that was back in the day. So the report, all right, also said that the wrong hormones were being used. Heart replacement promoters said that they were rolled out incorrectly, that they had new candidates, and many of these are bioidentical hormones already that the body already made. Now, I have problems with that term. Bioidentical hormones are made from soy or they're made from yams, okay? They're not made from anything else, soy or yams. Now, my problem with soy is that in this country, soy is 95% genetically modified. So if you're doing bioidentical hormones based on soy, then you're also getting heavy metal, glyphosate, and that kind of thing, which is not something that we want to have on there. Okay, so that's something that you need to look at. We're going to talk a little bit more about that in a minute. Meanwhile, while the women are just being bombarded with look younger, look prettier, don't be desexed, right? Then we've got the emergence of the low testosterone in men. All right, although they did not accuse men of outliving their testicles, the way they labeled women. Women are just getting older. They're outliving their ovaries. They're just old, right? Well, they don't do that with the men. The men, you're losing your virility. And so there's a there's a company that's on the television, and there's this real buff guy, and he goes, yeah, I don't want to lose my strength, and I don't want to lose this, and take this supplement, and she'll like it too. Well, yeah, I mean, that's good. But the marketing for men is a positive message, whereas the marketing for women was a negative message. So I just want to throw that out there, which is always, or maybe not always, but often it is the case that they're going to market differently to men and to women. All right. If men were losing their sex drive, their energy, their muscles, their looks, it wasn't aging. Testosterone was the culprit. A 40-fold increase in testosterone prescriptions occurred between 2005 and 2015, according to research by the American Geriatric Society. Many testosterone replacement products, including pills, injections, patches, gels, solutions, even underarm deodorants, have been approved by the Food and Drug Administration, but they also are not without risks. All right. According to researchers in the therapeutics and clinical risk management, risk can include worsening of benign prostate problems, heart failure, sleep apnea, and liver toxicity. Now, we know that the liver is the largest filter in your body. We know clinically, we know that by the time you're 50, you've done a lot of stuff. We have a dirty environment. We've taken drugs, we've drank, we've eaten garbage food, we've eaten food that is not food. We have synthetic clothing. We've got formaldehyde in our furniture. We've got formaldehyde in our carpets. We have genetically modified fruits and vegetables. We have all these things that are toxic that goes into the body. If the body is not able to detoxify itself, then sickness and disease sets in. That's why working with a professional and making sure that your liver is decongested, especially after the age of 50, is really important for your health. Now, I personally think that you need to decongest your liver every year after the age of 50. We do that. My husband and I do that, and we're pretty healthy, and we're not doing HRT. Just throwing that out there, okay? In an interview, a researcher, and this is a professor of medicine at the Boston University School of Medicine, said, low T may actually be a sign of suboptimal lifestyle and diet. Men who are in excellent health tend to have no decline in their testosterone. Men with common underlying problems such as obesity and poor fitness may. The irony is that poor fitness levels puts these male patients at risk for a heart attack and stroke, and they are being given a drug that further elevates those risks. Now, I just want to give you a little segue, because we're talking about men and we're talking about sexual function, and I'm all about that. I want us to have really good sexual function. Yes, I do. So when the men are taking the little blue pill or the little pink pill or whatever it is, whatever drug you're getting, what that does, it actually shunts blood away from your heart down below, right? That's why the television commercials say, if you have an erection lasting 4 hours, call your doctor. Why is that? Because your heart is what needs the blood, okay? And you're shunting that blood away from your heart so that you can enjoy your life. And I'm not necessarily opposed to that, okay? However, we don't want you to have a heart attack while you're in the middle of enjoying your life, if you catch my drift, okay? So if you are healthy, if you eat properly, you're not going to have those problems, which brings me to our biophotonic scanner. Now, why do I love this scanner? Because as you have seen in our videos, if you're keeping up with us on our videos, the biophotonic scanner, you put your heel of your hand on that little blue laser light, and it will tell you in 30 seconds what your nutritional uptake is. If your nutritional uptake is poor, which most people's are. So I've shown you this before, but maybe not here. I have this little basket of wristbands, right? Why do I have that? Because we have a slogan says, know your number. Now, my band is purple. Why is my band purple? Because I am at the optimal uptake of my nutrition. Red is the lowest level, and it goes red, orange, yellow, green, blue, and purple. I think that's how it goes. Anyway, most people that come in, they are in the red, the orange, or the yellow. Very few people are in the green, the blue, or the purple. Very few people are in the purple. We have seen people that come in, they do what I tell them to do. We get them over into the purple, and that's what we need. Why is that? Because if you are absorbing all of your nutrition, your liver has what it needs in order to detoxify naturally. Your body's going to be a flow system instead of a storage system. And so your cholesterol is going to be able to be cleaved and conjugated into those hormones that you need. So I'm just going to throw that out there. In a 2020 video, Doctors Mark Hyman and I'm not going to say the same because I'm going to mess it up. But there was another doctor, George P. We're going to just leave it like that. Agreed that lifestyle factors should always be considered, okay, before testosterone replacement is advanced. And yes, I agree with that. Okay. After the many dramas around HRT for women, I asked these doctors if nothing had been learned about reckless promotion of fountain of youth products. Actually, he said, marketers did learn from watching a hormone marketed to prevent the ills of aging. They invented the term andropause for a condition that numerous endocrinology experts says does not exist, and they began selling testosterone. So we are being marketed to, yes, Denise, it is very much like the sequence of colors and the chakras. And why is that? Because the chakra points, they are endocrine glands. All right. If you don't know anything about that, you might think it's New Age, it's Eastern, it's mysticism, it's whatever. That is all one side of it. But on the physical side, all of your glands that make a hormone have their own chakra points. Some of them share some points. All right. But your chakras are your energy centers in your body. We are biochemical. We are bioelectrical. And if those points are not doing what they need to do, then we're going to be in trouble. Now, I didn't bring any samples to show you, but I'm just going to tell you what we have here in the clinic. We have a adaptogenic hormone formula that is for menopausal women, and it is what it will do is it will enhance your estrogen or enhance your progesterone, whatever you need. And it is amazing for menopausal women. It is amazing for hot flashes. It is just amazing. Even our younger women who have cycles that are out of balance, we give them this formula and they just sync up and they have one cycle every month, just like they're supposed to. Us older girls, right? It is bioidentical because it is made from yams. Okay, no soy, it's made from yams. And there's some other herbs in there that cause it to be adaptogenic. And it is the most beautiful formula. I have taken it for years and I have no problems. We also have some, and it's oral, it's a tincture. We also have some estrogen and progesterone creams that are topical. My good friend, Dr. Julia T. Hunter, also medical. She is a foremost expert on female hormones, and she has developed these bioidentical pumps. They're creams that you can put on your body. They are absolutely amazing, and we do carry those here in the clinic as well. There are other brands that are out there. I know there are pellets and that kind of thing. So if you choose to do that, just have a long conversation with your provider and make sure that they do routine blood work. A lot of the people that come in that have their hormones, they have their blood work, they have their implants, and then they never get blood work again. They just continue to get the implants over and over and over and over. Right? So we don't necessarily think that that's a good idea. if your blood work shows that your hormones need some help and it's better than what you can get over the counter. And sometimes you do need medical support. Sometimes you do, and I'm not against that. What I don't want is I don't want you to go down to your pharmacy and get horse pee. Okay. I don't want you to do that. I want you to go and get bioidentical hormones. Will your insurance pay for that? No, your insurance will not pay for that. But your health is more important than what your insurance will pay for. Remember, synthetic hormones increase the risk of brain deficits. It increases the risk of cardiovascular events. It increases the risk to your immune system. We don't want that. We don't want that. And you are worth spending the extra money to get it done and get it done correctly. There is a lady that I refer out to. She does your blood work. She does the implants. Then she does blood work again to see where you are. And before it's time for your next appointment, she'll do blood work again, okay, to see where you are, because it's not a one size fits all. What you need to take away here is that bioidentical hormones have the exact chemical structure as indigenous human hormones. That means your body cannot tell the difference between a hormone that I make or estrogen that I get from a yam. It cannot tell the difference. And that's what you want. All right. So, estrogen, progesterone, and testosterone control many aspects of cellular growth. All right. It is found in all of your tissues, maintains normal brain function. They are important modulators of mood, cognition, and pain. So my time is up. I have a lot more to say about this, but hopefully you get the gist of it. Ladies, if you're not balancing your hormones, if you're postmenopausal and you're not balancing your hormones, you're setting yourself up for cardiovascular risk. Those are the statistics. 95% of cardiovascular events happen in postmenopausal women. So don't go synthetic because you're going to increase that risk. You want to go bioidentical. These are everywhere. Get a good brand. Make sure you get something that is, if you need to write to me and ask me, I'll tell you if it's good or if it's just hype. Okay. There's a lot of hype out there because women want to look pretty. Women want to be young. Women want to enjoy sex just as much as men want to enjoy sex. If we are hormone deprived, you are going to get that vaginal atrophy. You are going to get that vaginal dryness, and just nothing feels good when that happens. So you don't have to live like that. I'm mainly concerned with your heart. I'm mainly concerned with your health, right? Sex is a part of a good, healthy body. And so it all goes together. So hopefully gave you a lot out there. So hopefully you understood everything that I said. Hopefully if you have questions, you're going to let me know. Thank you for sharing. Thank you for commenting. And we're here to help you. It is the weekend. Enjoy yourself. Be good to yourself. And take care. I will see you next week. Love you. Bye.